Hello and welcome back to InfoCardia, where our goal is to summarize landmark clinical trials in the field of cardiology in under 10 minutes. If this is your first time on our channel, please consider giving us a follow so that you never miss a quick and educational video. So without further ado, let us begin today's discussion. Today we are starting a new series on the topic of aortic stenosis. Aortic stenosis is the most common valve disease in the developed world. Today, we will specifically discuss calcific aortic stenosis, which is an acquired aortic stenosis. The disease of calcific aortic stenosis involves the deposition of calcium plaques to the leaflets of the aortic valve. When significant enough, this deposition of calcium plaques can interfere with the way the leaflets open and close, thereby decreasing the efficacy of the aortic valve. In moderate and severe aortic stenosis, there is a significant decrease in the flow of blood from the left ventricle through the valve and into the aortic arch. When aortic stenosis becomes symptomatic, it's due to a decrease in blood supply to other organs. There are three cardinal symptoms of aortic stenosis. The first is angina, or chest pain. The second is syncope. And thirdly is congestive heart failure. Let us quickly discuss the treatment options. There are two main treatment options for aortic stenosis. The first is surgical aortic valve replacement. Given the name, this procedure is done in the OR. It is open, and it involves the removal of the stenotic valve and replacement with either a mechanical valve or a xenograft. The second option is transcatheter aortic valve replacement. This is a less invasive procedure and can be done in the cath lab. It involves gaining vascular access, typically in the groin, and the implantation of a mechanical valve. Now, with this brief overview out of the way, we can begin today's topic. Today's topic is a trial called the AVATAR trial. The AVATAR trial, or aortic valve replacement versus conservative treatment in asymptomatic severe aortic stenosis, is an international, prospective, randomized, controlled trial that compared the safety and efficacy of early surgical aortic valve replacement for asymptomatic patients with aortic stenosis to control groups who had conservative management of their aortic stenosis. The AVATAR trial had two main groups. The first group was the control group. This group did not receive any interventions. They received conservative management only. The second group was the experimental group. This group did receive an intervention in the way of surgical aortic valve replacement. Now, the commonality between these two groups is that all participants were patients who had severe aortic stenosis without symptoms. There were notable inclusion and exclusion criteria for this study. Inclusion criteria included males and females ages 18 or over, severe aortic stenosis, which was defined as a Vmax of greater than 4 meters per second across the aortic valve, a pressure average of greater than or equal to 40 millimeters of mercury, which is the differential in pressure across the aortic valve, an aortic valve area less than or equal to 1 centimeter squared, or an aortic area of index of less than 0.6 centimeter squared over meter squared. Also, patients were required to have no reported symptoms related to their aortic stenosis. Notable exclusion criteria included symptoms of aortic stenosis, a positive cardiac stress test, left ventricular ejection fraction less than 50%, very severe aortic stenosis, which was defined as a Vmax greater than 5.5 meters per second across the aortic valve. Also, other significant valve diseases like mitral stenosis or mitral regurgitation were exclusion criteria for this study. Additionally, any significant diseases involving other body systems like renal failure or COPD excluded patients' eligibility to participate. Let's talk about the primary endpoints for this study. The first primary endpoint is all-cause mortality. The second is major adverse cardiovascular events. These include myocardial infarction, strokes, as well as heart failure hospitalizations requiring intravenous diuretics or inotropes. Now let's discuss the numbers. The AVATAR trial took place between June of 2015 and concluded in September of 2020. The total group size was 157 subjects, with the control group including 79 of those, and the surgery group 78. Upon conclusion of the trial, it was clear that regardless of the endpoint, participants who underwent no surgical intervention and rather were treated with a conservative approach for their aortic stenosis had a higher incidence of negative outcomes. This was true in all three of the primary endpoints shown here, whether it's heart failure hospitalizations, mortality, or, with most statistical significance, adverse cardiac events. This rang true. The findings from this study revealed that asymptomatic patients with aortic stenosis who underwent early surgical intervention for valve replacement had a lower incidence of mortality, myocardial infarct, stroke, and hospitalizations due to heart failure. The AVATAR trial revealed that early SAVR is preferable for patients who have asymptomatic severe aortic stenosis, and so the recommendation was made for valve replacement regardless of symptom status. Though the results are compelling, one weakness of this study is that it has a low power. Additionally, 116 of the patients enrolled in this study came from one center. And that wraps up our discussion today. If you like what you've seen and heard, please consider giving us a follow. Don't forget to like, comment, and share the video with someone who you think might find this interesting too. Thank you again for joining us at InfoCardia, and we hope to see you next time.